Hi everybody, my name is Meredith Bessie and I'm a dietetic intern in clinical nutrition at the IWK Health Center Women's Site. And in this video today I just wanted to talk to you a little bit about some of the risk factors for gestational diabetes, so some things that are associated with diagnosis of gestational diabetes, as well as some of the risks involved with having gestational diabetes when you're pregnant. So I just wanted to talk first about some risk factors for gestational diabetes. So some things that are associated with the diagnosis include being over 35 years of age, having a family history of type 2 diabetes, being at a higher weight before pregnancy or gaining a larger amount of weight during pregnancy are also associated with diagnosis. If you've had gestational diabetes in a previous pregnancy, then you're more likely to be diagnosed again with gestational diabetes. If you've previously had a large baby, so bigger than 9 pounds at full term, then that is also a risk factor. If you have polycystic ovarian syndrome, then you're more likely to be diagnosed with gestational diabetes when pregnant. And then also some different ethnic groups are more at risk of gestational diabetes. So if you're Indigenous, if you're South Asian, African, Middle Eastern, or from a Mediterranean background. But I think it's also important to note that sometimes you have none of these risk factors and you still develop gestational diabetes. So I think it's important to emphasize that, if you get gestational diabetes, you didn't do anything wrong. You didn't cause this for yourself. Sometimes people just get gestational diabetes, and we're here to help support you with that. And also gestational diabetes is really quite common now, so approximately 8% of pregnant women will get diagnosed with gestational diabetes, and having this diagnosis does increase your chance of having type 2 diabetes later in your life. But if you breastfeed after you give birth, then that can reduce your risk of type 2 diabetes later in your life. And just to talk a little bit about what some of the risks are of having uncontrolled gestational diabetes. So it can lead to having a larger baby, which can lead to a challenging delivery. You can develop high blood pressure. You can also have increased amniotic fluid, so that might make your water break early, so you might go into premature labor. It can also cause hypoglycemia or low blood sugar, for the baby upon delivery. So they're used to having lots of sugar around when they're in your stomach, but when they're born, they don't have access to all that sugar. They have too much insulin in their body, and their blood sugars drop quite quickly. So those are kind of the general risks of having uncontrolled gestational diabetes. But we know that if gestational diabetes is controlled through diet and exercise and sometimes insulin for some women, the risks of these outcomes can be significantly reduced. So in some of the other videos, I will talk to you about diet and exercise, and some of the other things you should know about managing your gestational diabetes.